This podcast is intended for veterinary professionals. Whilst members of the public are welcome to listen, please note that the discussions are designed with a clinical audience in mind and may include technical or treatment-related content. If you are a pet owner with questions or concerns, we always recommend speaking directly with your own veterinary surgeon who knows your animal best. Hello and welcome to the Nupsala Podcast. Today we've invited Dr. Alex Keller to the podcast to talk to us about how she uses regenerative medicine in her canine patients. Dr. Alex Keller studied veterinary medicine at the Justus Liebig University in Gießen, where she also earned her doctorate. After several years as an assistant and additional training in veterinary chiropractic, she founded the practice for veterinary medicine and chiropractic in Frankfurt in 2005. Over the years, she's built up a specialised practice in orthopaedics, sports medicine and rehabilitation, which has been caring for small animals nationally and internationally since 2016 as the Veterinary Orthopaedic Team Frankfurt. Her speciality is the diagnosis of lameness and sports medicine problems, as well as conservative therapy for dogs and cats. This includes the application of regenerative medicine, therapeutic injection therapies into joints, tendons, muscles, and last but not least, chiropractic and patient rehabilitation. She's been an expert in diagnostic ultrasound for many years and uses this precise diagnosis in the area of musculoskeletal system and also for ultrasound-guided injection therapies. So, Alex, welcome. Thank you for coming along to our podcast. So, regenerative medicine is a huge topic, but today we're going to focus a bit more on the practical side and the treatments of our patients with musculoskeletal issues. So, I think we should start with a quick overview of what we mean by regenerative medicine.
Yeah, hi Meg, thank you for the invitation. And I'm happy to talk a little bit about my daily work. Regenerative medicine is one big part in our practice. So it's biological therapy, which we add to our patients in the part of the multimodal management. And we have got different possibilities in the small animal world. So we have got, for example, PRP, which we collect from the blood from the dog. It's rich on growth factors, for example, and we use it in acute traumas, in acute lesions in ligaments and tendons, but also we use it in osteoarthritis. We have other possibilities from the blood, so it is an autologous cells. So we collect that as well from the blood from the dog. You have to incubate it a little bit afterwards, and then we allocate it and inject it. The benefits from these are the main part is the anti-interleukin receptor protein or antagonist, and this interleukin-1 is one of the big, or should be a big role in the development of osteoarthritis. So we use this as well, and of course the stem cells are a big part, and it's getting more and more popular in the last years. So it's possible to collect them from bone marrow or from fat tissue. And beside these autologous systems, we do have other biological treatments like Atramid. It's a polyacrylamide. It is not with cells or natural, but it is implemented in the surface of the joint, in the synovial membrane, and so it modifies the action in the joint. So it's a little part of like biological as well.
That's really interesting. So we've got these biological side that we can get from the patient's own blood, and then we've got some other more off-the-shelf products that we can use. So why do you think that these medications have become so popular?
So I think in the last years, the orthopedics in the animal world, especially in the small animal world, changed dramatically because we have got different kinds now. It is not only a garden's dog, it is a family member, it is a sport dog, it is a working dog. And so we take care much more in the medical part, especially in the orthopedics as well. So we know from the orthopedics that we are limited in the effect. So if you only use medication, it doesn't work. So we have to do more. We add some rehabilitation, and we know, okay, only rehabilitation and pain management doesn't work. So we are looking more and more for other possibilities. And this is one big part where we add the autobiological therapies as well. And it got more and more important for the benefits for the dog or for the health and the movement.
Yeah. So you're looking at much more of a holistic approach to your patient's care.
Yes, of course. Yeah, you need this complement, multimodal management to be really effective and to be individual for every patient, because every patient is different. It is not that I can say, okay, this 1-year-old dog every time gets this therapy. It depends which dog is it, which owner is it, what do you want to do with the dog, and so on. There we have got a lot of factors which influence the correct therapy or the best therapy.
Absolutely. So if we were, you've just mentioned that it's not one size fits all for every patient, but if you were thinking about a dog with osteoarthritis, how would you go through like an approach to that using your multimodal technique?
So, as you said, it's not every patient in the same way. So osteoarthritis could be in really different ways. So it could be that it is a younger dog with only little changes in the joint. And for that, you need every time a really good and correct diagnosis. This is one really important part, I think, in the correct treatment. And if you see that you have got early changes, you can add your autobiologics in the joints. I would say if I've got a younger dog with only little changes, we start with the autologous therapies like PRP, ACS, sometimes stem cells in the young dogs, which little defects in the joint. And later on, or if we have got a young dog severe changes in the joint already, we add Artramed, like a 2.5 polyacrylamide therapy to modify the function of the joint. And on the other side, we have got really old dogs with severe osteoarthritis. And a lot of people think, okay, what could we change in these old dogs? And they are old, they don't have to move, but that's not true. So it is important that the dog is happy to move and that the dog improves the quality of life. And if you can change a little bit this possibility, you have got a really good effect and a benefit for the health of the dog. So if we treat these dogs, also if they have got severe changes in the joint, they benefit from the autobiologics. So they have got an improved range of motion of the joint. They have got, with that, an improve of the mobility. They move a little bit more. The muscles can work better. The back can move better. So all over, and that's what the owner recognizes and what we can measure with different tools we have, like a digital gait analysis. So you can measure the outcome. So also in this older dogs, you have got a really good effect.
That's really interesting, and I can see that there are options for every life stage, and adding in your multimodal technique means that everybody's dog has an option now rather than maybe just going for non-steroidals. And so, can you talk us through how you might go about harvesting PRP or stem cells, and what's that process from the patient coming into you to deciding that would be beneficial, and how do you harvest those in practice?
Yeah. So one thing is we have got different clients or different patients in our practice. So we have got this first income. So we have to do a complete diagnostic stuff. And on the other side, we have got cases which are recommended and referred to our practice. So this makes a little difference in the first treatment or in the first appointment, I would say. And if we decided we have to treat some joints with autobiologics, then we have to decide which way we are doing. Do we need PRP, for example? Do we need ACS, or do we need stem cells? Or maybe a combination from stem cells and PRP. All of these techniques mean that we have got a little invasive technique because we want to do injection in tendon, injection in the joint. Most of the times the patients are then a little bit sedated. They don't need a deep anesthesia, but they need to be a little bit more quiet. Depends a little bit on the dog. Sometimes it's possible to do it without sedation, especially with PRP and ACS things. And the how we collect it is that you have to take blood. Especially in PRP, we need a little bit more blood. So we every time use the jugular vein. It could be in sedation and without sedation. That's not a problem in dogs. And then we collect blood. It depends a little bit of the size of the dog, up to 50 ml. And then it is for PRP. It is we have got different techniques. So there's a filter technique. This is a little bit more older, I think. We use now the companion system, which means that it's a centrifuge, where we have got double centrifuge part, and after time of maybe 15 minutes, 20 minutes, we can use it. And this means if we have got the dog in sedated, we can do it in one cycle. So we take the blood, we prepare it, and then immediately we can inject it in the joint or in the tendon with or without ultrasound control. In the ACS, it's a little bit different because we have to incubate after collecting the blood. The technique changed a little bit. Now we have got possibilities from 3 hours to 8 hours, but that means it's not one step. Yeah. So the dog has to come back, and then we can use. We aliquot the ACS and freeze it, and then you afterwards. Perfect. In stem cells, it's different because it's more invasive. So at least we need a sedation for that. And we use regularly bone marrow from the femur. And it's every time a little small surgery, of course. You have to cut a little bit the skin, and you take your bone marrow probe. And then it's the same like in the PRP. It's a centrifuge system, and you can use it in the same step as well. With Atramid, it's much easier because you do not have collect blood, or you do not have to collect bone marrow. We can inject immediately. And sometimes if you have got a case, a quiet dog, it's possible to do that without any sedation. That helps sometimes in really old dogs where you're a little bit afraid of a sedation, so we can use it immediately.
Yeah. So you mentioned old dogs there, and some of those processes sound a little bit invasive, especially maybe taking the stem cells. Are there cases where you wouldn't want to go that far, or to use that technique in an older patient? Or what's your thoughts on that?
Yeah, so you also can use it in older patients. It is not that you need a really deep anesthesia. It's not like a surgery, like an abdominal surgery. It is not in a deep sedation like treating the teeth. So if you're cleaning the teeth, you need much more sedation than collecting the bone marrow or inject. So it is possible in older dogs as well. I would say if you have got these older dogs, as I mentioned before, with severe problems, severe osteoarthritis, I think the benefits from the bone marrow is not so perfect. It's more effective if you use like Atramid to improve the motion of the joint as soon as possible. And you have got this long effect of Atramid. So normally we have got an effect for at least 1 or 2 years. And that's really good for the older dogs as well. So if you have got this 13 years old Labrador Retriever, it really helps if you can fit the next year or the next 2 years. That's it.
Yeah, I can see that would be really beneficial. So what kind of joints are you selecting for either PRP or the stem cells, the Arthramid? Which joints do you most commonly use them in?
So I would say you can use every joint and every musculoskeletal system to treat with. Joints we regularly treat are elbow joints, of course, hip joints, stifle joints, shoulder. These are the really common huge joints. You also can treat phalangeal joints. It is less amount of volume, of course, but we use PRP, for example, and we use ultimate in the toes of the dog as well. We have got the dogs with the severe osteoarthritis in the phalangeal joints, or we have got this younger dogs, sport dogs with injuries, with traumatic changes in the joint capsule or in the small ligaments in the toes. And we have got really good effect. PRP, for example, in the stretch lesions in an athletic dog. So you can use it nearly in every joint.
Well, that's really interesting. We mentioned soft tissue lesions there. So what are the products that you would choose? You mentioned PRP, stem cells. Would you choose for your kind of tendon ligament injuries as well?
Yes. Yeah. So if you have got this tendon, ligaments, or muscle problems, we use PRP regularly. It depends if it is a big lesion in a tendon, in a big tendon in a dog, like in the biceps tendon, we can use stem cells and PRP because we need a little volume, but we can bring in. If we have got injuries in the superficial digital flexor tendon, for example, it's a really small and tiny tendon. So for that, it's not possible to use a lot of volume. So most of the times in the small tendons, we only can inject beside the tendon, because if you inject in the tendon, you have got such a big trauma that there's not a good effect on the tendon. So for that, we use regularly PRP.
Okay. So, for example, if you were a first opinion vet in practice and you wanted to get started doing using regenerative therapies for joint injections, how would you recommend going about that?
So, first of all, I think every vet can do it. It's not a big secret to do joint injections and to do the muscle injection or tendon injection. I think the biggest thing is to do a perfect diagnostic thing. And on the other side, you need a little bit training, maybe. That helps, of course, to inject some joints. It helps if you can first maybe some dead animals first to try it. And I would say a lot of joints are really easy to inject without ultrasound control. If you're used to it, to use ultrasound, and a lot of vets have an ultrasound tool in practice, it's really helpful, especially if you have got these traumatic changes in joints, like osteoarthritis changes, or if you have got old fractured joints where you want to have the benefit of the autobiologics. And for that, to find the perfect spot and to be really correct in the injection, it's helpful if you can do ultrasound control. And of course, if you have got lesions in the muscles or in the tendons, it's important to see where is my defect, because you will feel it immediately from the outside.
Yeah, absolutely. I can understand that. So if you're a first opinion vet in practice and you wanted to get started in this, then probably doing some CPD and ultrasound guided how to get the best out of your own ultrasound machine will be beneficial as well. So we've got our patient, they've had their treatment. What kind of follow-up do you recommend for the vet to see this patient through?
You mentioned a really important point. Follow-up is the key of the treatment, I must say, because it's not that you can leave them alone and say, okay, everything is fine now. That's not correct. So it's only one part of the multimodal management of the patient. So immediately after the treatment, if it is possible, we want to see the dog back 2 days after. So if the dog has to drive far away, maybe we recommend to go to a regular vet at home to check if it is a joint or if it is in a tendon, if there is any problems. Do you have an inflammation or change like that? And I like it better if the vet recheck that. So regularly after 2 days, then the dog has to undergo a little bit restricted movement. It's not like after a surgery that they couldn't move at all, but they do not have a race competition at the weekend after better, or they don't go to the holidays and go to the beach and running all the time. So a little bit restricted movement, and at least for 10 to 14 days. And it depends if it is an acute trauma, it's completely different management. But if you have got this chronic diseases, and at least 4 to 6 weeks after, we want to see the dog back to see if the dog improves in motion, in movement, or if we have to add something, or if we have to change something in the other therapies, or if we have to add maybe some painkillers as well. So after 4 to 6 weeks. And if I got the chance, 2 months later, again, because some treatments need a little bit more time. It depends which cases we have. Sometimes if the complete movement, motion, muscles has to react and to build up again, and it can take 2 to 3 months if we have got this really good benefits. And we said, okay, now we are having this. That's good.
Okay. Yeah. So on average, it would be a 2-day follow-up, lead exercise only for maybe 14 days, another checkup then, and then maybe 4 to 6 weeks later, and potentially another couple of months down the line.
Yes.
And give or take, depending on the case. Yeah, absolutely. Great. And you mentioned some other therapies there. So maybe non-steroidal drugs. When you're using regenerative medicines, what's your protocol with whether a dog should stay on the medicine, or should they come off them? Do you give anything afterwards?
Okay, so it's again we could not say every time it's the same thing. So if I've got the perfect case, I want to remove NSAIDs if I use the autologous systems like PRP stem cells, because I need a little reaction of my body. If I use the steroids or NSAIDs, I put down the reaction from the body. But on the other side, I have got these really old dogs with severe changes. If I remove the NSAIDs, they fall down. so in this cases, I stay with the treatment as I had it before. So in the ideal world, after PRP, for example, I don't want to see NSAIDs. I add physiotherapy, especially with laser therapy, to increase the effect on my autobiologics. And add physiotherapy and add immediately building up muscles and the motion of the joints, treating with underwater treadmill or treadmill, going in the regular motion, things like that. And that's a part.
How soon after having regenerative medicine might you suggest hydrotherapy or physiotherapy? Would that be from the start to keep them going, or what would be it?
So if you do not have these acute cases where we have got a trauma and a ligament rupture, where we have to be really careful, or if you have a post-surgery and we are in the rehab program. So if you have got a chronic case, you can start immediately after a few days. So it depends. If you have got more bone marrow, we have got cut. I don't want to put the dog in the water, but after 14 days, of course, we can start. If we only have joint injections, we can start a week later. So okay. I only give them a few days, and but then they can repeat with the rehabilitation.
That's great. And as one of your specialisms is chiropractic. Can you just talk to us about how you fit that in with your patients with your multimodal technique?
So the one big thing I learned with the chiropractic is that I every time treat the whole animal. So that's a really important thing for me. And it is important for the movement, for the health, that the muscle, the bone, the nervous system, everything works together. And with the chiropractic as manual therapy mainly of the spine, but also of the joints, you have got the effect on the function. And this is one main part in our practice. So we want to restore the function of the musculoskeletal system. So regularly we add the chiropractic in our multimodal management as well. So additionally to rehabilitation and underwater treadmill, physical therapies, we add the chiropractic as a regular treatment.
That's great. Well, thank you so much for chatting to me today. It's been really interesting to hear how you approach your patients with regenerative medicine and the chiropractic. So, just to summarise, what 3 things would you like our listeners to take away from today?
Okay, only 3 things. No, okay. Yeah, I will say, first of all, autobiologics, it's not only a trend. I think it's really important for the treatment in the modern orthopedic practice. So it's a really important therapy for the benefits in the dog, and we can measure it. We can measure it subjective with the owner, we can measure it objective with digital gait analysis that the dog improves after autobiologics like PRP, like ACS, like arthritis. So we have got the different opportunities. One big thing is it's not an alternative thing to the other medicine we do have. So that must be clear. It's not the one and only thing. So we have to add it to complement our other therapies. Yeah. So we have to add our proper diagnostic as well. That's the main thing, I would say. And we have to add maybe pain management. We have to add rehabilitation. We have to add the chiropractic. We have to add the education of the owner, because that's one important other part, because we have got these different dogs. We have got this old geriatric dogs, but we also have working dogs or sport dogs, young sport dogs, which has to do a lot of training, and so we have to teach the owner. And the last thing I would say, it's a possibility for every vet to use autobiologics. It is relatively easily go in a training to learn the techniques. You should not be afraid of this. And helpful, of course, is training. So try to do ultrasound in every dog you got, every possibility you get. And I think it is a benefit for every vet to add these techniques in the daily practice.
Thank you. Thank you so much for joining us.